Michelle Muller. I'm an assistant program coordinator for 2 of the adult residential programs, both Pleasant House and IACT. Pleasant House, which is a 6-bed female-only home, forever home for older females, and IACT is supervised apartments. So essentially both of them are more independent settings where we're kind of working on building up their life skills and supporting that, and even supervising while they do it, helping them learn those skills. To get the opportunity to really get to know the individuals, really get to know, what they feel they need to work on, what they feel like, what their goals are, where they want to be. For me, it's not just the process and all that work that gets put in, but we also get to see it happen. We go through that journey with them, and then watching at the end when they do achieve that goal and that sense of accomplishment, being able to support that person through that process, and then watching that sense of fulfillment on their face when they do achieve those goals. It's something that I feel is very rewarding, and which is why a lot of us are in the field that we are, and it's just something that is just irreplaceable, those moments.
Certified community behavioral health clinics were designed nationally to meet the needs of underserved, vulnerable, and often invisible populations. CMHA is one of 3 organizations here in Connecticut that has the opportunity to expand services, and we were able to create and meet the need of an aging population here at CMHA and also in our community, which allowed us to create the older adult care team. We also were able to create the Arab Community Support Services team to meet the growing need of Sudanese and Yemenis population. One of the other opportunities that we had were we were able to expand services to our veterans.
I've been struggling with my mental health for more than 20 years. It's been on and off, really hadn't gotten anywhere. And I was pretty much on the brink of just calling it quits. Ever since the moment we walked right through the door, it was like, it was very
family oriented.
Yeah, they embraced us. The whole program embraced us, and they made sure that not only I have the resources that I need, but what really got to me was that they offered the same to her and the same to all of our family. It was great the way Vic came into the fold and said, "Hey, look, I'm not going to pretend that I know everything, but I know enough." And since that moment, it was like maybe 3 minutes into the conversation, the walls just dropped, and it was like, okay,
It was a good experience.
Yeah.
I just think I did a whole 360 when it comes back to this position with peer support. I did peer support for 4 years in high school, and it was on a peer level with my friends and other students. Now I'm actually the adult, and I'm peer supporting, our young adolescents, and I see like a complete need for peer support aspect of things in the community, and I just feel like it's amazing. Our biggest collaboration now is with Waterbury PAL. We are gonna start doing their drop-in mentor nights again. So that's gonna be based every week. And it's when the kids come in 5 to 7 and they hold like presentations, groups. We just promote ourselves and just honestly let the kids know that we're here. And me as a peer, I go in there and I'm like, hey, you guys can talk to me. You guys don't necessarily need to be scared of the clinician or therapist portion of it. I feel like we have such a diverse staffing here that it's real easy to connect with our community and engage on a different level. They see us and they see a little bit of themselves. So I feel like we're really good in representation in the community and just showing them that we're here for you guys.
Well, I think CMHA has been an excellent partner in furthering goals, especially in our mentor program and our Girls Inspire program. Working with Wendy, who is our contact from CMHA, is a peer navigator and creates a lot of opportunity for the children in our organization. Through her skills and CMHA's backing, we're able to create safe space where kids feel comfortable talking about behavioral health needs and issues, and we're able to support them in a much stronger way. CMHA's subject matter expertise has been very beneficial to Waterbury PAL, not only the members of PAL, but the staff here as well. so we can understand what it is we need to provide our community and our members to be more successful.
As you know, mental health services, especially for young people, have always been difficult to access and to find. It was exacerbated during COVID. We have seen that our students and their families have been able to access what were previously unobtainable services that are out there. And the extended day treatment program has made it possible for young people between the ages of 5 and 17 to actually be assigned a case manager, and for their parents to work on their behavioral health and to continue to nurture their emotional and their cognitive development over time. So that's been a very successful program as well.
Healthcare is so important to the whole trajectory of life for individuals. And so while we do what we do really well, we can't improve the overall health and wellness of people without partnering with organizations. And CMHA has been really one of those key partners for us from the beginning. Partnerships are powerful, and you cannot do this work isolated. You can't do this work siloed. You can't do this work on an island, whatever analogy you want to use. You can't do it in a vacuum, and the needs of our residents have just continued to increase. I think, we're just on the cusp of seeing what the psychological, the medical, the emotional, the physiological impact of living through a worldwide epidemic has had on all of us, that collective trauma that we've experienced. And so we won't be able to adequately support the folks we care for or our workforce without partnerships.